Hi everyone, how you doing? Today, let's look at the different options you have for a full arch dental implant solution or even a non-dental implant solution. But instead of looking at it from an aesthetic point of view, let's look at it purely from a functional point of view. So today's video has actually been inspired by one of you guys, one of our viewers, Leon Peterson. And he wrote a comment on one of my recent videos, and he says, how about discussing functionality of different solutions? I got false teeth 5 years ago, and in my opinion, they are absolutely rubbish. 1950s technology at 2017 prices. Everyone is concerned with aesthetics and nobody talks about functionality. Please give us this information. Okay, and I read this and I thought, you know what? You are right, okay? But there's a number of reasons which we talk about aesthetics first. So I will talk about the different solutions. I'm going to talk about a removable partial denture, zero implants, and mini implants or locator dentures, so teeth which you can click in and out depending on whether you have mini implants or normal implants. And then we'll look at the full fixed solutions. And I actually asked one of my patients, a few of my patients, not many, have had a different solution top and bottom. So these people are the most ideal people to talk to because they can give you first-hand knowledge about the different solutions and in real life what the differences actually are. Okay, so stick around, that's towards the end of the video and it will be super, super useful. The first thing I need to kind of address is why I particularly, and a lot of other clinicians, will talk about aesthetics. Because the truth is, when it comes to aesthetics, what we're trying to do is to replicate nature. We're in a situation where we've got no teeth or very bad teeth, and we need to basically turn back the time, and aesthetics is a big component of this. And also, if somebody is in a kind of a buying mindset, they're thinking of kind of going down the road of this kind of stuff, aesthetics is important. And I know that I'm guilty when I'm buying stuff of putting aesthetics in front of function. Let's say I went to the guitar store and I wanted to buy a guitar. I would be drawn towards the ones that I like the look of rather than the best sounding or the best feeling, okay? This is completely the wrong way to think about stuff, but we are human and aesthetics, for the vast majority of us, plays an important role. And maybe this is why so many people go to countries abroad to get a cheaper level of dental care. If you look at their websites of all these places, they look fantastic. It looks like a really nice dental clinic, right? We make assumptions based on the visual appearance of stuff. Now, in my particular situation, the way I kind of was brought up in dentistry was aesthetics first. I worked in a very smile design heavy practice where people came to us primarily for aesthetic improvements. We did a lot of veneer work and smile design work there. And I've kind of taken that to my implant surgery. I find implants more interesting, but I still want to create beautiful smiles. And the truth is, if you are able to put the teeth in the right place, which looks right, okay, driven from an aesthetic point of view, usually the function isn't going to be a million miles away. Because remember, we're trying to replicate nature, and nature's done a pretty good job at getting function and consequently aesthetics, okay? Because the function's correct, we've grown accustomed to a look of teeth, and that's what we feel is aesthetically pleasing. So all of these solutions look identical. Let's make that assumption. And it's not a bad assumption because we can make everything look amazing. From a I have to live with this point of view, what are the differences? Okay, now this isn't the only influencing factor in terms of the decision, because cost will have an influence on the kind of treatment which you would prefer. So if we look at the three solutions, which is one, a removable denture, zero implants. This is the most cost-effective solution. Then we go to a removable solution where we've got implants, but we're clicking teeth in and out. This is our kind of mid-range solution. And then we've got our top end in terms of cost solution, which is the kind of all on fours or fixed teeth on dental implants. And Apart from the cost, they differ in terms of how stable they are. Okay, now there's a difference between stability and retention. I'm not going to really cover that, but let's say a resistance to moving around. Okay, what can you eat with these kind of things? Now, removable dentures for some people can be really, really strong. I mean, here's a little video clip of me. I've just what we call relined a denture, made it fit a bit better, and you can feel just by looking at the photo that this is pretty strong denture. Okay, now dentures can be made like this, especially top ones. Bottom dentures are notoriously difficult to get on with. Okay, and the reason for this is dentures rely on the surface area. Okay, they need a hard palate. At the bottom, we don't have a hard palate, and they don't like muscle attachments. So the things which pull a denture out are the muscles which attach into the side of the jaw and our tongue muscles. Because every time we talk, these muscles move and they effectively push this denture out of position. Now, people can get along with this after a period of time. It does take time to kind of reprogram your muscles and learn to talk and to eat in a slightly different way. Okay, there's no way you can start eating apples and expecting it not to move. You can eat apples, but you will have to control the movement of the denture. So there's a bigger learning curve with a removable denture. Now, there's also kind of the size of the thing, which I'll come back to in a minute. But if we look at our mid-range options and we look at our mini implants and our normal implants with locator attachments on them, these are the same thing. They're dentures, but they click into position. They are much better at resisting the forces that want to move the teeth out of position. So remember the muscles which are trying to effectively do their job, but as a side effect, they're pulling the dentures out of position. But also we can get over that problem where in the lower jaw, we're reliant on surface area of hard tissue, okay, gum on bone, essentially, because we've got less of that and we've got more at the top. Top dentures are better, but the mini implants and normal implants which click in will go a long way in terms of improving the stability of that prosthetic. Now, if we go to the other extreme, a fully fixed set of teeth on dental implants, this is effectively our gold standard. There is no reliance on any soft tissues. We're not relying on the surface area on the bone. We are away from any muscle attachments. So this is the most secure solution. And this is the solution that patients can't remove by themselves. So from a purely stability point of view, this is our gold standard. However, the removable dentures are better in terms of cleaning. It's easier to take them out, give them a good clean, and come back to it, and you click them back in. With these click-in dentures, there are foods which are going to dislodge it. Okay, it's not as solid as it looks like in these video clips, because we've got fresh locators in position. They are really strong, but over time these will wear out and they might need replacing once a year, something like that. We call it servicing them, which has its own cost, but any of these solutions will have an ongoing cost as kind of a servicing cost. Now, with the click-in dentures, the number of implants you have and the size of the implants, mini versus normal, is going to have an influence on how strong they're held in. So the more implants you have, the stronger it is. And also, if we go for normal implants rather than mini implants, they click in a little bit more securely. Okay, so let's look at our three solutions, but this time from a size of appliance point of view, okay? Because bulkiness is important. And I know this from having conversations with my patients. When they have an all-on-4 treatment, the temporaries are pretty bulky, but when they have the final bridges, the final ones are a lot thinner, and this makes a difference. So our initial prosthetic, i.e. the removable denture, is the bulkiest. We need that surface area, which we've discussed. We need to cover the roof of the mouth, typically, especially if we're not using a kind of a chrome denture. And that provides a suction. But in order to get that suction, get that surface area in contact, we need to increase size. If we're looking at a plastic denture, then plastic gets its strength from thickness. So we need a certain amount of thickness and coverage of the roof for it to do its job. Now, for some people, this isn't a problem. For some people, it's a really big deal because it affects speech, it affects your ability to taste. And because of all of these reasons, this is why Leon feels that his denture is terrible and, it's 1950s technology at 2017 prices. And this is true because a denture is a really well-engineered piece of plastic. Okay, that's all it is. And the cost goes into the lab technicians and the whole process of making the denture. You're not literally buying a piece of plastic for 2017 prices. Okay, it's all the effort that goes into making it. But there's limitations in that kind of prosthetic. And for some people, those limitations and compromises are not a big deal. I've got so many patients who are just living with dentures and they find it absolutely fine, which is great. But the people who we see for implants, for them, these compromises are a step too far and they want something better. So if we now go on to our click-in dentures, the size of the prosthetics dramatically starts reducing and we can use more metal in the construction. Now this has the advantage, the coverage of the roof of the mouth, okay? I typically don't cover the roof of the mouth when I'm making these locator dentures. Technically you should, because the denture is reliant on surface area as well as the implants. But I know that we can get away with exposing a bit more of the roof of the mouth. This lets you feel the texture of food more. It also improves the perception of temperature of food and also the taste. We have taste buds in the roof of our mouth. Okay, so your experience of food is improved with locator dentures. Now, using metal in the construction also has the advantage. One, it conducts heat very effectively, but secondly, it reduces the thickness dramatically. Okay, so because metal is stronger than plastic in thin sections, that's why we've got these advantages to the prosthetics, having metal in the skeleton of the locator denture. Now, you can have metal in a removable denture. I don't have loads of experience, but there are two patients who I can think of where we have done this, and they absolutely loved their denture. It does add a little bit of weight, but if the suction is good, the extra weight doesn't really matter. Now, if we go all the way to our full fixed option, then the thickness is minimal. Okay, it's almost as thin as your natural teeth, and from a speech point of view and an intrusiveness on your tongue and your cheeks and lips and things like that, this is the most ideal situation. And the only reason we can do this is we don't need the extra size for strength. We don't need the extra size for coverage over the soft tissues. When I talk about our full fixed solutions, there are a number of different materials that we can use. We can have kind of like a metal skeleton with acrylic teeth over the top of it, which are great. Probably about 70% of the patients we treat have this. The downside to this is that occasionally a tooth can chip off. Okay, and this comes into kind of from a functionality point of view. Okay, it's annoying when that happens. There is an upgrade. We can have zirconia teeth, which are very unlikely to break. I have broken a zirconia bridge, so it's not indestructible, but it's much, much stronger than the acrylic ones, and there's less issues in terms of teeth breaking after they're fitted. So if we try and wrap this up, what is the best solution? And there is no best solution, okay? The best solution is the one that makes you the happiest with the least amount of treatment. So some people will want to go out there and buy the absolute best thing that they can, okay, because that makes them feel good. I mean, if I literally just look at my wrist, this is a Garmin smartwatch and it's the best one that they do, okay? I wanted to buy that. Do I use all of the features that this has got? Absolutely not. I probably use the same features as they've got on their most basic watch, but there is this thing, if you're able to afford it, sometimes you just want to know that you've got the best thing. And that plays a factor in our buying decision. Really, what you need to do is kind of decide which compromises are you okay with, and work out the different cost points at your dentist. Everybody charges different amounts for this kind of stuff, and see what makes sense for you. Okay, if you go with one option, let's say you go with a removable denture, okay, because you think, well, it's so cheap, I want to see if I can get away with it. Okay, cheap in comparative terms. Okay, I know they're not actually cheap, but I do this for a lot of my patients, especially when I'm undecided what is best for them. I say, okay, well, why don't we just go with this like entry-level solution, see how you feel, and if it's a problem, then we've got the option of moving further down the scale. Usually those people who have mini implants or normal implants, we're kind of committing to something. You can change a kind of a locator denture to an all-on-4. I've had one person question me about it after they've had the treatment, but we've never actually done it for anybody. Because any solution you have with implants is dramatically better in terms of retention and stability compared with a solution where we've just got the denture on its own and nothing hard to hold it onto. Don't take my word for it. Here is a conversation that I had with one of my patients, and she had locator dentures at the top, and she had a traditional kind of all-on-4 at the bottom.
The bottom one, I would say, feels more secure because it is. And you're not the top one. Mine's on a 3 implant, whereas most people, if they can, they'd have 4. So it balances better. But that one with a longer pin felt more secure than the shorter pin. So it can move when I'm eating. I think it depends what you're eating, obviously. Well, when we first did it, there was these extra like wings on it. That wasn't too comfortable.
Oh, the top one?
Yeah.
Yeah, because we reduced that in size.
We took it off,
and
it made a lot of difference. You can still feel the thickness. I don't think the thickness is a real problem. And obviously your mouth has to get used to that, a foreign body in your mouth. We're not born like that, are we? If your own teeth are always going to be better, aren't they? But if you have a problem, like I have had a problem most of my life, it's a good feeling that you've got your teeth in your mouth.
Yeah.
So the top is far easier because you can get around the implants. You can clean the teeth because you can take it out and you can see it can be spotless. You don't have to have any food on that at all.
There's no guesswork, is there?
No. You see, at the bottom, you have to be careful that you do try and make sure there's no food left there because obviously that is going to damage the implants. The holes don't bother me at all, really. It's just that's not a problem, the holes. You can put the brush in and out them 3 gaps. And whether I'm lucky or not, I don't know, but I don't seem to retain a lot of food there. So whatever is going on, I don't find it a problem. No.
Okay.
No, I'd rather have the fixed ones.
Fixed ones.
But there is that little bit of worry, is it cleaned properly? It's always at the back of my mind. I'm quite happy today because I've been here and you've seen it after a few months and you told me it's not too bad, it's like that bit in the middle, but that bit in the middle is the hardest to clean. It will be for anyone. Yeah. But out of choice, I would go for top and bottom with implants. Out of choice.
Yeah. So I hope you found this useful. I hope you found her unique insight useful to your decision. And if you've got any questions, comments for future videos, you can always leave them in the comments below. I read a lot of the comments. I can't get through all of them, but if you do have a good one, chances are I will see it. Okay, guys, until next time, take care.